After being discharged from the hospital, it was about 2 weeks until my first post-op appointment with my surgeon. During that time, I wasn't in too much pain, aside from just the gas pain that I had had during the hospital stay. I was taking a stool softener every day to avoid being constipated, and I'm glad I was doing that, because even taking the stool softener, I was a little bit constipated, and that's not fun when you've got stomach muscles that are tore up and you've got a catheter in. I was giving myself Lovenox injections every day in the belly. That's a blood thinner that they use to prevent blood clots after surgery. I didn't like giving myself the injection. In fact, I thought that I might have my wife do it, but I ended up being more comfortable doing it myself. Once I got past the fear of giving myself an injection, actually doing it wasn't that bad. The needle's really small and it doesn't hurt too much. It's just the medicine that stings afterwards that makes it unpleasant. I had a home nurse that could have come up to 3 times a week, but I just had her come once a week. Really just to check on my incisions and check on how I was taking medication, and just really for peace of mind. I think the biggest problem I had during the first 2 weeks was sleeping. It was really tough to sleep because I had so many tubes. I couldn't lay on my side because I had SPT on my right side and I had a drain on my left side. And I certainly couldn't lay on my belly because I had the catheter and all those tubes. So I had to lay on my back, and I couldn't really move much or change position. So when I would try to sleep, I would move from the bed to the lazy boy to the couch and back all night, just trying to find a comfortable position to lay in. And there really wasn't one. There was no way to get comfortable. So I had, because I couldn't move too much, I had a lot of back pain. That was probably the worst part of the recovery, was that kind of pain and not being able to sleep very well. I had to irrigate 2 to 3 times a day. So my wife stayed home from work for a few weeks to help take care of me, and she would take a large syringe and inject saline in through the SPT, and I would clamp the Foley closed, so that would fill up my neobladder. And then she would use the syringe to draw the saline back out, and that would pull any mucus that was in the bladder back out into the syringe. And we normally do that twice with about 60 milliliters of saline. If there was a lot of mucus, we might do it a few more times. And then she would push 60 milliliters of saline into the Foley and let it drain out of the SPT. Because both the SPT and the Foley, they go into the same place. They go into the bladder. They just come in at different angles. So we do the irrigation 2 or 3 times a day. And I continued walking. I probably walked about three quarters of a mile a day on our treadmill. I'm really glad I had the treadmill. Even though we never used it in the past, it was kind of just a clothes hanger. But after the surgery, I used it a lot because I didn't want to walk outside, because I didn't want to carry around the bags outside. So the treadmill was nice to have. So 2 weeks after discharge, I had my first post-op appointment with a urologist. So at that appointment, he pulled the kidney stent out, and that was uncomfortable. It hurt a little, but it was mostly discomfort. All of the tubes had some kind of suture at the end that would seal the incision shut when he pulled the tube out. So as he pulled the stent out, I could kind of feel something going on my kidney, where it was closing the incision up. And I had to kind of like snake through my body to get out. So it was uncomfortable, but it didn't hurt very much. Then he pulled the JP drain out, and that hurt a little bit more. I think it was just kind of snaked through my abdomen a bit more than the kidney stent was. It wasn't horrible. Again, just kind of more discomfort than pain, and what little pain there was went away pretty quickly. So he pulled the stent, pulled the JP, and left in the Foley and the SPT. So 2 of my 4 tubes came out during that first post-op appointment 2 weeks after discharge. About 4 weeks after discharge, right before my second post-op appointment, I started noticing increased mucus during irrigation, and I started to get a fever. So both of those are signs of a urinary tract infection. UTIs are pretty common after this kind of surgery. So at my 4-week post-op, they pulled the Foley catheter out, which itself was going to help with the UTI because it gets that foreign body out. So they pulled the Foley out and they left the SPT in place. During that appointment, right after they pulled the Foley out, they used the SPT to fill my bladder up. So they injected, I think probably 100 milliliters of saline into my neobladder using the SPT, and then they had me urinate it out. I was terrified of this appointment. I thought I was going to spew pee everywhere and be totally incontinent when they pulled the Foley out, but I wasn't. Happily, I was able to hold the urine in, and then he taught me, or told me how to release my pelvic floor muscle, and then use my stomach muscles to compress the bladder and push the urine out. That didn't come naturally, and it took me a few seconds to kind of figure out how to let the urine go. So I tried pretty hard, and at first he had me try to do it standing up, and I had troubles doing it standing up, so I sat down, and that helped a little bit. So I got a little out the first time I tried, and then I kept trying a few more times, and I pushed a big chunk of mucus out. He called it a mucus plug, and he said that's typical when they first pull the catheter out, that there'll be kind of an accumulation of mucus that comes out. And once I got that out, it was a lot easier to urinate. So once he saw that I could do it, he took a sample of urine to see what was causing the infection. Ended up switching my antibiotic. He had me on Cipro as a preventative measure ever since the operation. So for the last month, I had been on Cipro. And they ended up changing me to Bactrim. And then once they got the urinalysis results back, they switched me. They found out what bacteria was causing the infection, and they switched me to Macrobid. But anyway, that day he took some urine for a urinalysis and sent me on my way with some Depends for the ride home, just in case. So after that second post-op appointment, when they pulled the Foley out, I kind of had my first experience with continence. Like I said before, I was afraid I was going to not have any control at all, and I was just going to urinate all over the place without any warning. But I was surprised by how much control I did have, even that first day. I kind of set a timer so I'd remember to go every 2 hours, and that certainly wasn't a problem. I didn't really make it 2 hours. By about an hour or an hour and a half, I'd start to feel the urine kind of start to want to come out, and I'd have to clench it off with my Kegel muscles and hobble to a bathroom real quick. And as the days went on, that got easier, and I didn't consciously flex my muscles to hold the urine in anymore. I kind of realized, at first I was like tensing my pelvic muscles, pelvic floor muscles as much as I could, and kind of clenching my Kegels to try to hold the urine in, and that really turned out to be not so necessary. After a few days, I realized I could kind of relax and not consciously flex those muscles all the time. I think I only had one leak during the daytime, and that was when I was relaxing on the chair and I didn't have a timer set, and I fell asleep. I kind of took a nap, and I woke up right when the urine was kind of starting to come out, so I clenched it off real quick and was able to run to a bathroom. But because I wasn't leaking, I pretty quickly switched from Depends to briefs with a pad, and then within a few days switched to boxers during the day. And I'd really only wear briefs and a pad when I went somewhere where I wasn't sure I was going to have ready access to a bathroom, like a long car ride, or if I went and saw a baseball game or something, I might wear some briefs and a pad. But normally I just wear boxers like I always did before during the day. Nighttime's kind of a different animal. Lots of people have trouble with nighttime continence. I think some of the muscles that I use to hold the urine in are more voluntary muscles, and I lose those muscles, like relax at night, and it's harder to keep the urine in. So I had stocked up on all kinds of different adult diapers and pads, just in case I had trouble at night, because so many people do. So the first night I tried to wear super absorbent giant adult diapers that some people online said they held like 1,100 milliliters of urine, so a lot. But those were way too big, and they didn't breathe. They were really uncomfortable. So I pretty quickly just switched to regular Depends. And I, just like during the daytime, I would set a 2-hour timer. So every 2 hours I would get up and urinate. But I never really had any issues. The Depends were always dry. The only time I would have a problem is if I forgot to set the timer, and that happened a couple times where I'd either feel the urine start to come out and I'd wake up quickly and run to the bathroom, or I'd just wake up and be wet. That only happened once. So I had really good luck with even nighttime continence, as long as I stick to the timer. So even today, I've still got, months later, I still do a 2-hour timer. I'm kind of planning on increasing that slowly. There have been times where I've forgotten to set the timer, and I've woken up 3 or 4 hours later and been okay. I mean, I was pretty full and I had to go, but I didn't leak everywhere. So hopefully I can increase my interval at night from 2 hours to maybe 3 or 4 and get some more sleep. So after the second post-op, I continued irrigating through the SPT. So I at that time I didn't have a Foley, so we'd push saline into the SPT, and I would kind of clench my Kegels to kind of fill the bladder up, and then we'd pull the saline back out of the SPT, and that would pull any mucus out that was in the bladder. And then sometimes we'd just push in through the SPT, and I'd urinate out normally. And we'd try to drain the SPT and see how much urine was left in the bladder, just to get an idea of how effective I was urinating, because it's hard to get all the urine out. There's some tricks I learned I'll talk about in a later video, but it's sometimes it's difficult to get all the urine out. And if you don't get it out, there's a chance that you might develop bladder stones, which require surgery to remove. So we continued irrigating while we had the SPT, and during that time the SPT really served as a emergency release valve of sorts. So if I found that I couldn't urinate for some reason, we could always use the SPT to drain my bladder in an emergency, but that was never necessary. But it certainly made me feel better to have it there, just in case I couldn't urinate, because I was going into it. I was really nervous that I wouldn't be able to figure it out, or something would happen and the neobladder wouldn't work right. So it was nice to have the SPT there, just in case. 6 weeks after discharge, I had my third post-op appointment with my urologist, and at that appointment, they removed the SPT, and once again I demonstrated my ability to urinate. So they brought in like 4 different nurses to watch me pee, just because I think they don't get to see it very often. So after that, I didn't have any kind of external tubes. All 4 of my tubes were gone. And by that time I had gotten a lot better at continence. I was wearing boxers all the time, even at night. So I went back to wearing the same underwear I wore before my surgery. I'd still urinate every 3 to 4 hours during the daytime, and every 2 hours at night. I think the only problem I had at that time was I started to get sore in my hips and my stomach muscles. I think just from using those muscles to pee so much, and they're muscles that I hadn't used before. So I'd get sore, and that soreness was enough to wake me up at night. So even though I was trying to get up every 2 hours, I ended up getting up about every 1 hour, just because my hips and my muscles hurt so much. And then every time I got up, I would urinate because I get nervous. Can't always tell how full I am. So whenever I think about it, I kind of just go to the bathroom whenever I stop and think about it. So about every hour I'd get up from the muscle pain and I'd go urinate, and that urination used those muscles and made them even more sore, which caused me to wake up even more. So it was a vicious cycle that went on for a couple weeks. Eventually my muscles started to get stronger and they weren't sore anymore, and I kind of worked my way out of that vicious cycle. But for a couple weeks it was kind of hard. During that time frame, I developed another UTI. I got a pretty high fever. There was never any pain during urination, like a normal UTI would have. So I kind of had to monitor my temperature to make sure I caught the fever. And I went back to the urologist, and they took another urinalysis and put me back on antibiotics again. One of the important things to know about UTIs, as I said before, they're pretty common after a cystectomy, and especially with a neobladder. One important thing to know is that because the neobladder is made out of small intestine, there's gut bacteria that's always present in your urine. So if you suspect you have a UTI and you get a urine culture done, there's always going to be bacteria there, and that bacteria is it's supposed to be there because your bladder is an intestine now. So you can't have cultures anymore, you have to have a urinalysis. And they have to figure out exactly what bacteria it is to put you on the right antibiotics to get rid of it. I think neobladder is a pretty rare operation, and there's probably some doctors that aren't aware of that. So it's something that you have to tell the medical staff about if you have a UTI and you don't go to your normal urologist to get it checked out. About 8 weeks after I was discharged, I had my final operation. So during my second term, they placed a stent in my left ureter to keep the ureter open, because the tumor that was removed was right next to my ureter, and they didn't want the scar tissue to close up that ureter. So they placed a stent, and that was back in, gosh, I think it was probably December. So in December they placed a stent in my left ureter, and then they were going to remove it during my cystectomy in April, but it wouldn't come out because it had calcified. So I had a 4-month-old stent at that time that was calcified, and it was clogged up. So my left kidney was swelling because I couldn't release any urine. So during the operation, in order to make sure they didn't harm my ureter by trying to pull that stent out, they just placed another stent in my left ureter. So I actually had 2 stents in my left ureter to keep that kidney functioning. Well, 8 weeks after that operation, I had another operation to remove both of those stents. So by that time, the first stent was 6 months old, and this other stent was 2 months old, and it was probably going to calcify up, just like the first one did. So they had to get those out. They're not meant to stay in there for very long. So they used shock waves. They call it extracorporeal shock wave lithotripsy. So they blasted my abdomen with shock waves under general anesthesia, and then went in transurethral, like using a rigid cystoscope, to remove all the calcification. So the shock waves broke up the stones, and they were able to remove the stones and pull the stents out, both of them. And they also, while I was under anesthesia, removed my chemo port. My oncologist said that there was only like about a 10% chance of recurrence, given how well I'd responded to the treatment, so he was okay with removing the port. So after that, I was pretty much back to normal. I had no port, I had no stents, I had no tubes. There was a chance that they were going to have to place a temporary stent back in my left ureter after removing the first 2 stents, just to make sure that any scarring didn't close the ureter up. But my urologist was pretty confident that that wasn't necessary, and I was glad that it wasn't necessary, because those temporary stents have a string that goes from the bottom of the stent through your bladder out your penis, and that's the string they use to pull the stent out when it's time to be removed. And that string would have been detrimental to my continence, my doctor said. And at that point, I was just starting to get really confident about my continence, and I didn't want to have any setbacks. So luckily, that wasn't necessary, and the 2 stents just came out pretty easily, he said. So after that operation, I was pretty much back to normal. In fact, about 4 weeks later, about week 12 after discharge, I went on a 2-week vacation with a long road trip and a lot of walking, and not always ready access to restrooms. And I did fine, so I'm really happy with the results. So here's a quick recap of all the events that took place from diagnosis through all my treatment and to my surgery and the post-ops and when I went back to work. I think it spanned about 9 months in all. Kind of feels like a lifetime to me, but just 9 months from symptoms to remission. It's pretty amazing.